Hello, I'm Dr. Garima Agarwal. I'm a consultant nephrologist and transplant specialist from Manipal Hospital Varthur Road. Today, I want to drive home a very important message that even in women who suffer from kidney failure, pregnancy is possible.
मेरा नाम अमरनाथ निषाद है, माई वाइफ पूजा साहनी। 2020 में हमको पता चला कि इनका किडनी फेलियर हुआ है। जब हमने हॉस्पिटल में दिखाया तो उनको डॉक्टर्स ने बताया कि इनको किडनी ट्रांसप्लांट करना पड़ेगा।
Now this case, she was a young, just married woman when she was diagnosed with kidney failure, and it was a devastating news to her. She was started on dialysis. We discussed the options of transplant, and I remember one day before her transplant having a conversation with her about what are her desires and hopes, and she told me, doctor, I always wanted to have a baby. I always wanted to be a mother, but I guess it's not possible now. And I reassured her and I told her, no, it is possible. If all goes well and if you follow the plans, it's possible.
2020 में जब ये ट्रांसप्लांट हुआ तब आई थिंक हमको रेगुलर फॉलोअप करना पड़ता था, और इन रेगुलर चेकअप और हर चीज़ नॉर्मल है, ये सब चीज़ें हॉस्पिटल से हमको दिखा के, डॉक्टर से दिखा के और सारी चीज़ें मेजर करके डॉक्टर को कंसल्ट करना पड़ता था। जब हमने प्रेगनेंसी का प्लान किया तो डॉक्टर से कंसल्ट किया तो डॉक्टर ने बताया कि 2 साल बाद प्लान कर सकते हैं, और साथ में उन्होंने बताया कि क्या क्या चैलेंजेस हो सकते हैं, क्या क्या चेंजेस करने पड़ेंगे अपने डाइट्स में, अपनी दवाइयों में। उसके साथ उन्होंने सारी अकॉर्डिंग टू द प्रेगनेंसी उन्होंने चेंज किया दवाइयाँ, और फिर वो प्रेगनेंसी के लिए हम लोग प्लान किया।
There is an option of getting pregnant after a successful kidney transplant. However, there are certain precautions that must be taken. See, what happens is in the initial transplant period for about a year, patients are on very high dose of medications, immunosuppressions. And at this time, it is not a good time for you to try for pregnancy. So we advise all of our patients, just like we did in this case, we told her that for the first year, you must use good contraception. Make sure that there is no chance that you get pregnant, because right now the doses of the medications are high. We are waiting for your kidney functions to stabilize. Also, we advise our patients to undergo something known as a preconception counselling, meaning even before you decide to go ahead with pregnancy, you must inform your doctors. So after a period of 1 year is over, a couple informed me that, doctor, now we wish to get pregnant. And so at this time, what we do is we change some of the medicines that the patient is on, because some of the transplant medicines are not good for pregnancy and are not good for the baby. So once they informed us, we changed those medicines. These medicines should be changed about 6 to 8 weeks, even before conception, even before you start trying. Once that was done, we gave them a go-ahead to please go ahead and start trying for a baby. They were also in touch with our obstetrician. These kind of pregnancies are better managed at fully equipped multidisciplinary hospitals like ours at Manipal Varthur. With the obstetrician and us, we got the good news that she is conceived and she is pregnant now.
Hello all, I am Dr. Anand Patil, Consultant Neonatology and Pediatrics, Manipal Hospital Varthur. Divisha was born very preterm and very low birth weight. Divisha had breathing difficulty for initial couple of days. To support her, we had started her on CPAP for about 2 to 3 days. Later, once she got better, we started her on the mother feeds, the tube feeds, which we graded up gradually on an incremental graded basis. Once her tube feeds, she reached the full feeds, we started her on cup feeds and the direct breastfeeding. By about second week, we could able to achieve that. Later, at around 6th day, she started having neonatal jaundice, which we commonly see in most newborns and pretty much often we see in preterm and low birth weight babies. Once mother got better, we started the baby and mother kangaroo care, which is the most cost effective and simple ways of taking care of the very low birth weight babies. We also screen the baby for the to rule out infections, also to look for if there is any bleeds in the brain. All the screening tests, be it retinal assessment, newborn metabolic screening, and as well as hearing assessment done for the baby, she has passed. Overall, Divisha is a God's gift, what I can say, because mother and the baby, what they have gone through, mother especially post-transplant, she was under various medication, being taken care by the Dr. Garima, and she is being closely monitored by the nephrology team.
So I just want lakhs of women suffering from kidney failure to understand that pregnancy and fertility can be restored after a successful kidney transplant if you are in good hands, if there is a multidisciplinary approach, and it's teamwork, which means your contribution is as much needed as the doctor's contribution. And at the end, we were all very happy when one day we took a picture of her mother, who's her donor, her who's the patient, and her daughter. So 3 generations of happiness because of a successful kidney transplant and a well-managed pregnancy.
We are very grateful to nephrologist Dr. Garima Agarwal and Dr. Anand Patil, Pediatrics, and as well as Manipal Hospital Varthur Road.